Ladies and gentlemen, we'll get started with our final panel for the day, revisiting philosophical perspectives. And we have three experts to illuminate us. The first is Dr. James Giordano. He does many things. He is the Departments of Neurology and Biochemistry Georgetown University professor, and he's also a distinguished fellow at the Stockdale Center. Secondly, we have Dr. Josh Stuchlik. He's professor of philosophy at the University of St. Thomas in St. Paul, Minnesota. And he was at one point a fellow at the Notre Dame Institute for Advanced Study. And he's a moral philosopher and a Stockdale Center fellow this year. Thank you for being with us this year, Josh. And then finally, Dr. Patrick Smith, class of 1973, Fred Minier, resident fellow at the Stockdale Center, and previously of the University of Twente, and then he spent 1 year at Stanford University, right? 2, okay. And then how many years at University of Singapore?
3.5.
So he's been around, okay. So you have to watch him. All right, so that with that introduction, it's all yours.
Thank you. Appreciate it. How's everybody? Oh, thank you. It's very kind. How's everybody doing? No, please don't applaud at the end. This way I deserve it or not. And so what I'd like to do is sort of frame what you've taken thus far and base it on a very, very important premise. And let me walk you through this premise very, very quickly. And here's how I want you to do it. I'd like everybody, please, to close their eyes. This is not a rhetorical question. Do it. Close your eyes. What I'd like you to do is I'd like you to take your left index finger, put it firmly in your mouth. I don't care where it's been. We're all friends here. And I want you to bite down on that index finger as hard as you possibly can. Thank you very much. Okay, moving on. Bottom line up front. Anybody denies their biology after that exercise, you're a fool. So what we've been talking about to this point has been a lot of wonderful psychosocial philosophical stuff that I think has a real place in the education and training of not only cadets, but of active duty military, perhaps more broadly with regard to individuals who are here to serve. What are those virtues? Well, bottom line is I'm going to take you from the Nicomachean Ethics of Aristotle to contemporary neurocognitive science in about 5.5, 10 minutes. And the way I choose to do this is very, very simple. Follow the bouncing ball. If we consider virtues to be, as we say here, incised traits of character, and an operational definition of character coming from Dorland's medical dictionary is that character represents a reliable expression of mental traits. This is a psychological and psychiatric definition for sure, but I think it obtains because a similar definition is found in the Oxford English Dictionary. And we consider those things mental to be at least some integral or summation of neurological processes in a brain. Not exclusively. I mean, we're thinking this is perhaps a little larger. I'm not a Cartesian. It's not that mind is something else. But I have to tell you, I've been a neuroscientist for 42 years this year. And if someone were to put a gun in my ear and say to me, all right, how is it that mind occurs in brain? I'd be pulled the trigger. I don't know. Not because I personally am stupid. It's because the field has not figured it out. This is what's been called David Chalmers' proverbial hard problem of neuroscience. And it's something that we wrestle with. We just don't know how mind occurs in the physical brain. But more and more, we don't care. More and more, as long as we get a pattern of some type of structural activity in the brain, we can correlate pattern to function, and we can use that as targetable entities. And if we can't, I'm here to tell you, like there's a big old New York nose on this face, our international peer competitors are already doing that. In the past presentation, one of the things we heard about the technological revolution and what that would affect in terms of Clausewitzian warfare as engagement between humans. What we forget is that very often humans modify their environment to suit. More and more that environment is internal. Go with me. If that's the case, we know that neural systems exist in an embodied organism. By training, I'm a neurologist, a neuropathologist, but I look out over this sea of faces and bodies, and I don't see a bunch of soupy, sparking nerve cells just sitting there flopping around like a fish out of water. It occurs in bodies. And that body of yours grew up in an environment, functions in an environment, responds to and exercises effect in that environment. So you can't take the brain out of the body, and you can't take the body out of its ecology. And to be able to do that, what ends up happening is we need to fit in those ecologies and those environments well so that we can both cooperate and compete. That's truly human nature. We're not hardwired to do anything other than be essentially very keen and sensitive to social cues. And many of those moral cues that we now consider to be ethical are nothing more than social comportment. How do we get along well with others? What does it mean to get along well with others? And historically, if we look back on morality, it's not necessarily been uniform. Oh, it's wonderful to sit and quote a bunch of long-dead white guys from the ancients, but the truth of it is that morality is very often defined circumstantially by individuals with distinct needs, values, cultures, philosophies, and as a consequence, those values desiderata, what they want and how they get along well with each other, that's what defines morality. So what we know is that these neurocognitive functions that are part of who we are, human nature, if you will, allows us to do that exceptionally well. If we're hardwired, and I hate the phrase because the brain is not a wiring diagram, it works far more like Wi-Fi than a telephone line. What we know is we're very sensitive to those cues, social cues, and we respond to them psychologically. Now, if we go through this, this really provides us with something we call neuroecology. It's not a bunch of words. I'm not throwing out there a neologism. It's a real term. I want to define ecology for you from the antiquarian Greek, oikos, logos, a rational counting of our households. I don't care what that household is. I don't care if it's your backyard, your neighborhood, your country, or the globe. The fact that we engage these neurocognitive processes to be able to take a look at how we interact with others in ways that we define to be good or not good, and how that comports to what we hold near and dear, is critical to understanding how virtues come to be, and how virtues can in some cases be demeaned and or misinterpreted. What's good for me may not necessarily be good for you. But the way the brain actually does this is quite simple. We take our experiences and we weight them relatively so. Come on, function, there we go. Come on, there it is. We weight them as we go through our various experiences in life. Moral decisions, ladies and gentlemen, are no different than any other decision our brain makes. As I said, I've been a neuroscientist for 4 decades. There is no nucleus moralis. There is no tractus ethicus. It doesn't live anywhere in the brain. It lives everywhere in the brain. So our moral decisions differ because very often what we see is moral decisions engage what we call a reciprocal valence. They are certainly about us, as all of our decisions are, but they affect others, and they affect how others will regard us. Now, I want you to think about that for a moment. When our research group came up with this based upon some rather interesting neuroimaging work coupled with some cognitive stuff we did about 8-9 years ago, we damn near got nailed to a cross for that. Because our argument was as follows: every altruistic act has an egoistic component. Let me say it again. Every altruistic act has an egoistic component. And there's a reason for that. I want you all to take a really good, hard look at me. Try to hold your lunch down, but just look at me. Do you, yeah, thanks a lot. Do you, there's one in every crowd. Do you know if I'm a machine or not? Do you know if I have thoughts? Do you know what I'm thinking? Do you know what I feel? No. But you know what you're thinking. You know what you feel. Consciousness is subjective. It begins with the self. What we then have to do is transpose and juxtapose how I feel based upon how others react to me and how I react to them. So everything we do that is about others has to be resonant with me, first and foremost. It's as old as the hills. It's the golden rule. Do unto others, you know how the rest of it goes. Why? Because the only thing we can know in the subjective first person is me. Everything else is explanatory. That gives us really good insight to the way our brains work. This is some work that I've done with my colleague at National Defense University, Dr. Diane DeUlis. And we've reframed the proverbial OODA loop of John Boyd, the Air Force fighter pilot, who was trying to teach his pupils how to react quickly, appropriately, in the fast turn and burn milieu of sort of the air combat environment. We've added to this based upon what really happens, and this is what we refer to as the BUDAC loop, where the B stands for biases, Bayesian biases. Those biases affect how we observe things, how we orient to those observations. Those things fuel our decisions generate our actions generate consequences, and those consequences are either consonant or dissonant with our expected biases. Every decision you make, ladies and gentlemen, goes like this. Every decision. It involves memories, it involves experience, it involves the emotion of those memories, how you frame them. What this tells you is the brain is a highly trainable organism. Your brain is a time and space machine. What it essentially does is it rockets you back in time and space to say, do I know this or do I not? Do I know something close or not quite? You know the adage, I don't know if I'm going to like this. I've never had this before. Tastes like chicken. All right. That's the Budak loop. That's presuming you've had chicken. Now, if you've had chicken in a drunken stupor, let's just say that last night you went to a Bruce Springsteen concert, you didn't sleep much, now you're dragging and you have chicken and you decide, well, now I'm going to get pretty sick. You might not have chicken again because that's called the Garcia effect. These types of effects, where we take our past and project it into our present so as to be able to predict our future, that's exactly what we do. Go or no go, act or don't act, say something or don't say something, fire or don't fire. So the idea that we have this situates what we do between our past, our immediate present, and how we then engage the future. Folks, that's virtue. What are those incised traits that shape not only how we observe the world, but how we orient to it, and how those observations and orientations based upon long-standing incised biases, traits of character, ultimately will affect the way we decide and act in a variety of circumstances in this multiplex hierarchy. Well, if we think about this, come on, work. If we think about this, I'm going to sort of reduce this down to a very simple equation. Nothing is worse after 1500 than math. Forget about the math, go to the bottom. The way our brains work, the way every organism's brain work, I don't care if you're a sea slug or if you're an O6, makes no difference. And I'm not comparing any O6 to a sea slug. I was a lowly O3. It's like this. Expected value of gain has to be greater than equal to expected value of loss. Think about everything you do in your life. Everything. Everything. Do I turn left or do I turn right? Do I stop for a full 3 seconds at the stop sign or do I just sort of go through it? Is there a cop across the street? Is there a kid on a big wheel in the intersection? Do I want chicken or fish? Do I want red or white? Do I want vodka or gin? All of those things are predicated on, is it good or is it not? Good for who? Me. Oh, yes, we know all about those supremely altruistic engagements where the individual throws themselves on the proverbial hand grenade. But there is a flash, an absolute flash of instant that says that makes me a good fill in the blank. Friend, comrade, buddy, Marine, sailor, soldier, airman, guardsman. For those of you who wear the Marine Corps uniform, you know it takes a while to be called a Marine, and part of that is the process that says, once a Marine, always a Marine. What does it mean to be a good Marine? Never leave your buddies behind. This idea that it has to be good for me, even though it's good for others. But this is important, folks. Take a look at this because this is the crux. This is your target. If we can make our young people, if we can make our trainees, if we can make our individuals whom we lead and who follow, and those who we follow, understand that each and everything that they do must have intrinsically positive value for them, even though it affects others, we've won the virtue game. This is what Aristotle was talking about when he talked about critical balance in arithaics and eudaimonia. When Aristotle referred to the fact that all this exists in a critical balance of what might be considered virtue, but not necessarily vice, the absence of virtue, and that it has to resonate for self across a range of circumstances and contexts, it was this. Aristotle wasn't a neuroscientist, but if he were, this would be in the Nicomachean Ethics, Part 2, the neuroscience of the Nicomachean Ethics. So if we take a look at this, what I'm telling you is quite simple. It takes a whole brain, just like it takes a whole village to figure out what is moral and what is not, to be able to instantiate those morals into formative codex, which we call ethics, and then to have some form of retributional factor, which we call law. But it's more than that. It's who's watching. And what do you do when nobody's watching, when in fact the only thing you're relying on is that Budak loop of yours? That's what we look to instantiate. Now, an interesting question becomes, are those potential mechanisms in the brain targetable? In other words, as you'll hear subsequently, can we use the cutting-edge neuroscience and technology to in some way make these Budak loop-type functions far more capabilized? Well, I'm here to tell you, ladies and gentlemen, after 10 years of research, once again, there is no moral site in the brain. I don't care how you spark it. I don't care how you twink it. I don't care what you do to it. You're not going to make people more moral. because there's no common morality. What you can do is you can leftwardly shift their decision and cognitive curves, which if we take us back just a little bit, back to this, you can affect this. You can affect the keenness of their observation and its valence. You can affect the fortitude of those prior biases and predispositions. You can affect those gatings for what might then be to act or not to act. Those are affectable. Those are affectable. Is that morality per se? No, it isn't. Is that constituent to those processes that could be defined as morality? Sure. Do you need high tech to do it? No, of course you don't. Aristotle knew that. Lucretius knew that. Ignatius knew that. Adolf Hitler knew that. The whole idea of Deutsche Jungvolk and Hitlerjugend, give me your youth. I'll teach them what I want them to teach is good. Know it is good, and they'll do anything because they believe it's good. That quote comes from Goethe. If you want people to do terrible things, don't tell them what's bad. Tell them what you want them to believe is good. It was repeated again by Nietzsche. It's repeated again by Hannah Arendt, who talked about the banality of evil. So realistically, if we consider how we can frame this in real-world ecologies that you live in of leadership and fellowship, where that occurs in the variety of hierarchies that exist from garrison all the way to la guerre, war. We need to remember those processes. And we need to also remember that, in fact, our transatlantic and trans-Pacific peer competitors may have one step up in that saddle with regard to utilizing high-tech science and technologies to be able to engage those processes in ways that they define to be good, that might necessarily not comport with what we define to be good. But more than that, there's another question here. The question here is, if we really push this down the rabbit hole, for those of you who want to sit and think philosophical thoughts and perhaps go outside later and look at the lint in your navel and call me or email me and say, well, gee, are you really saying we've got no free will? No, I'm not saying that at all. Although I think it makes a viable enough argument. It just depends on the level that we're talking about. Cells, groups of cells, aggregates of cells, systems. Where does free will live? We could talk about that both philosophically and neuroanatomically for hours and hours. But I can't tell you what my brain is squirting. I can't tell you right now that my serotonin levels are through the roof and my dopamine levels are squirting like a Johnny pump. I can't do that. I can only tell you how it feels to be me. And you can't necessarily see what's going on in my head. Even if we can, using state-of-the-art equipment, we can't see it at that level of granularity. But let me tell you what we do know. We can certainly argue that there may not be free will because it exists on a variety of levels, from literally molecular physics all the way to mass effect. From the cellular to the social, to the individual to the international, we can have this debate. But let me tell you what we do know. You got free won't. That you've got. How do neural systems do what neural systems do? The elegance of those systems is by inhibition. At every single millisecond of your time, ladies and gentlemen, you're being bombarded by information, both from inside you and from outside you. I don't see anybody standing up and going, I can't stay here because my spleen hurts. Nobody's doing that. It's only if I begin to talk to you about your shoes, your socks, your undies, at that point you'll, oh, I feel them now. You know that. If you had to attend to literally everything that your body was telling you, everything in your environment, you would crater. So what your body does, what your brain does, what your nervous system does so elegantly is provide a bandpass filter. And that exists all the way from the levels of senses to sensibilities. That's where we exercise our virtues. It's not just what to do, it's also what not to do. This is phronesis, practical wisdom. This is the prudence that Aquinas talked about. This is the phronesis that Aristotle talked about. This is the idea of balanced wisdom and knowledge and practice that Alistair McIntyre talked about. And it's written on the wall of the Pantheon in Rome. Recta ratio speculabilium recta ratio agibilium dat. The right measure of thought to guide the right measure of action. This we can harness. This we can train. This we can inculcate. And so, for those of you who may want to dive deeper into some of this, I provide you with some of the work we've done over the past 10 years. What I've hoped to do in these past few minutes that I've had your attention is to illustrate the neurobiological and the biopsychosocial reality that is you, that is us. We can affect our social environments. We can affect our psychological environments and how individuals both receive and express psychologically, and that's the expression of virtue. We can inculcate that and reinforce it through deed, through act, through environment, and through institution. And increasingly, the more we understand about what's going on in those soupy, sparky cells that exist in each and all of our heads, the more we'll understand about the things we have in common and the things we have in difference. And if someone said to me, Jim, if you were commanding officer of all that is for a day, what would you do? I would sort of demand something that I'd like to call maybe precision education. We talk about precision medicine and personalized medicine. Can we take what we know about the brain and funnel that into the way we treat minds so as to make those individuals who are to lead in ways that are very important to what we hold near and dear ever more moral? I leave that to you. Thank you for your time.
Dead white man.
Dead white guy.
Now about dead white man.
Well, hello, everybody. I'm here to talk today about practical wisdom or prudence from the perspective of Thomas Aquinas. This to work. There we go. So, practical wisdom or prudence has traditionally been regarded as one of the four cardinal virtues. Cardinal comes from the word for hinge. The idea is the whole moral life hinges on having these four virtues. So we have temperance, prudence, fortitude, and justice. Aristotle states that moral virtues in their fullest, most mature, or unqualified sense presuppose practical wisdom, as Dr. Cochran was telling us earlier today. The reason for this is that acting virtuously requires making good choices, and making good choices reliably requires wisdom. Moreover, as I'll explain in a few minutes, practical wisdom is necessary in circumstances where the right thing to do is not determined by general laws or principles. This makes practical wisdom especially important, I think, in military contexts, for the rules and regulations that govern armed conflict are thinner than those that apply in ordinary civic life. And the consequences of poor decision-making in war can lead to great harm to others. Finally, if we are serious about measuring ethical virtue and assessing programs of character development, then we'll have to develop tools for assessing practical wisdom. Yet, when we turn to ethics curricula, discussion of practical wisdom is often missing, or at least explicit discussion. The required ethics course here at the Naval Academy, NE 203, is a case in point. It features weeks devoted to virtues such as justice, courage, healthy self-love, and self-control, but practical wisdom is nowhere explicitly thematized. I think some of the case studies the course takes up at various points are relevant to practical wisdom, but they're not grouped together or flagged as involving it. And maybe we can talk about that more in the Q&A section if you're interested. Perhaps that's not too surprising, though. Even among philosophers, there's unclarity about what practical wisdom is. What does a prudent person have that less wise people do not? Right, if we think about how we define these different virtues, I think prudence might be the one that's most difficult for us to define. Right? We all know that justice involves respecting people's rights, giving others their due. Courage or fortitude involves being able to restrain fear and regulate daring. Temperance involves controlling our emotions and our desires, especially desires for pleasure. But what is prudence? What does practical wisdom involve, and how is that different from other kinds of wisdom? Even Aristotle devotes only a handful of pages to practical wisdom, and his treatment of it is not a model of perspicuity. One scholar even calls it maddeningly obscure. My proposal is that we can increase our understanding of practical wisdom with the help of Thomas Aquinas. Aquinas has a theory of practical reason and practical wisdom that is strongly influenced by Aristotle. But his account of prudence is developed in far more depth. Just in conducting research for this talk, I noticed 59 articles in the second part of the Summa on prudence. I think this makes studying Aquinas worthwhile if we want to improve our understanding of this virtue. Unless you worry that it's somehow untoward to utilize the writings of a religious author in a secular context, after all, Aquinas was a Dominican friar, it's important to add that he categorizes practical wisdom as an acquired virtue, meaning that it's possible to understand it, possess it, and exercise it regardless of one's religious commitments. In the remainder of this talk, then, I'll explain how Aquinas understands prudence as an excellence or perfection of practical reason. I'll then briefly discuss the different intellectual skills and abilities that he sees as being the components of prudence. Wrong direction. So, according to Aquinas, reason plays three roles in the process that leads to human action: to deliberate, to judge, and to command. Following Aristotle, Aquinas states that people deliberate about the means to an end. Sometimes the means are obvious, or the action is a routine one, in which case deliberation will not be necessary. So there's no need for me to deliberate about how to get out of bed in the morning or brush my teeth, for example. But many situations in life are not so simple as that. In these cases, the function of deliberation is to generate possible plans of action that will effectively realize or achieve the agent's end in a way that seems prima facie acceptable, given the agent's other aims, concerns, and ethical principles. The characteristic question of deliberation is therefore how? How do I attain this end? What do I need to do to accomplish it? Now, a person's deliberation may generate multiple possible courses of action that will be effective, or at least have some probability of achieving her end, and all of which are prima facie acceptable. In this sort of case, which I take to be very common, she must evaluate which course of action is best to pursue in the circumstances, all things considered. It is the function of judgment to assess potential plans of action. On Aquinas' view, there is an intimate relation between judgment and choice, for the agent's judgment about what to do specifies the content of her choice. The final place where reason is involved in human action is command, which pertains to the execution of one's choices. The role of command is especially apparent when there is a difference between the time at which an agent chooses what to do and the time at which the choice is to be carried out. I may decide, for example, that I need to undergo a painful dental operation 6 months from now. When the date of the operation arrives, in order to actually go to the appointment, I must continue to affirm that it's good for me to act on my previously deliberated choice, and I must not somehow rationalize it away. The prudent person, then, has a stable disposition to do well at the three operations of practical reason. He deliberates well, and so is excellent at generating potential solutions to practical problems. He judges well, and so is excellent at evaluating which solution is best to pursue in the circumstances. And he commands well, and so excels at following through with his choices. The task for the theory of prudence, then, on this model is to specify what is involved cognitively in doing these things well. I'll turn to Aquinas' account in a moment, but before doing so, I want to say something about the relation between prudence and general ethical principles. Aquinas does believe that there are some general ethical principles. Think of the Ten Commandments, for example, and that following them is necessary for virtuous action. But ethical principles on their own are not sufficient to ensure that someone acts well. Some principles function as guidelines, while others are fixed points that may never be transgressed. One never acts well or virtuously if he commits murder, for instance, which is always an act of grave injustice towards another. Nonetheless, ethical principles only rarely will necessitate a single course of action. Even if you know you shouldn't commit murder, that still doesn't tell you what you positively should do in the situation. After all, there will be many options still left open that don't involve murdering anybody. So in other words, in most situations, there will be a gap, sometimes a very wide gap, between ethical principles and the judgment of how one should act. It's the job of prudence or practical wisdom to bridge this gap, ensuring that one acts well by making and executing good choices when these are not determined by general principles. Right? So the sphere of human life, where there can be better or worse ways to act, but the right thing to do isn't determined by a general principle. That's where prudence especially comes into play. So what does it take to have practical wisdom or excellence in deliberation, judgment, and command? According to Aquinas, practical wisdom is not propositional knowledge. It's not a body of knowledge that something is the case. So it's not the kind of thing you can just pick up a textbook called Practical Wisdom, read the textbook, and then have the virtue. No, it's not like that. Rather, prudence is a set of intellectual skills and abilities. So here I think there's a consonance between what Aquinas is saying about prudence and what David Brooks was saying about the moral life earlier this morning when he was talking about it in terms of developing certain kinds of abilities or skills. And Aquinas refers to these different skills as the parts of prudence. He identifies 8 integral parts of prudence, which are components of practical wisdom in the same way that the foundation, walls, and roof are components of a house. He arrives at this list by synthesizing remarks from the writings of Aristotle, Cicero, and the Stoic philosopher Macrobius. I've added some additional conceptual structure by categorizing the parts of prudence he lists into 4 groups of 2, which you can see here on the projector. So I'll start at the top with what I call virtues relating to the end. 2 of the integral parts of prudence, shrewdness and understanding, enable the agent to select the right ends for deliberation. A prudent person, we said, deliberates well, and an episode of deliberation will be good only if its starting point is good. The starting point will be the end to be achieved. Aquinas writes that shrewdness is the ability to acquire for oneself a correct estimation of what is to be done. I think of it as the virtue of situational classification. Shrewdness enables the prudent individual to quickly size up the situation, picking out the details or factors present in it that interact with the concerns of the ethical virtues that he or she possesses. The shrewd person is thus able to skillfully answer the question, what sort of practical problem am I dealing with here? Is it, for instance, a situation that calls for the fair allocation of some resource, or one of helping others in need responsibly, or tactfully telling someone an uncomfortable truth, for instance? Closely related to shrewdness is understanding. Understanding is skill in specifying the particular end that one should pursue in one's circumstances, given all the practical saliences one has identified in it. A virtuous agent will possess certain characteristic desires, loves, and concerns, and these appetitive states presuppose cognition, for we desire things only insofar as we apprehend them as being good in some respect. The prudent agent understands what the human goods are and how they are to be correctly ordered, and his understanding interacts with his construal of the situation to enable him to select the particular goods he should pursue or evils he should avoid in it. Once the agent has identified a goal to pursue, the function of deliberation then is to seek out means that are capable of achieving or realizing it in a way that is prima facie acceptable, given her other concerns and principles. Foresight and reason are the parts of prudence that perfect deliberation. Foresight is the ability to order one's present actions to an end which is at some distance from them. The agent with foresight understands the causal powers of things, and this enables her to know what she will or may be able to bring about through exploiting relations of cause and effect. I would also include ingenuity under foresight, since an ingenious person has the ability to come up with plans for achieving his ends in creative and imaginative ways. A person who is skillful at reasoning can then employ her causal knowledge inferentially to generate possible plans of action for achieving her end. In many situations where prudence is called for, our practical problems will be complex, and deliberation may generate multiple possible solutions, all of which have some chance of success and none of which seem immediately unacceptable. The role of judgment, then, is to evaluate potential plans of action, determining which is best to pursue in the situation, all things considered. The two parts of prudence that pertain to judgment are circumspection and caution. As its name implies, circumspection is the ability to skillfully examine and take into account all the relevant circumstances before making a practical judgment. Aquinas writes, quote, "It is possible that something that is good and appropriate to the end, when considered in its own right, is nonetheless rendered bad or inappropriate for the end by something that comes together with it," end quote. In other words, even though a certain option may seem acceptable at first sight, a careful examination of the circumstances may turn up some consequence or other factor that makes it somehow suboptimal in comparison with the alternatives, or even inadmissible altogether. For instance, the goal of a UAV operator may be to take out a wanted terrorist, and it may initially seem like a good idea to do so at a certain date and time. However, the operator then realizes that the target will be attending a wedding at that time, and that targeting him then would involve excessive collateral harm to innocent people. A prudent person also recognizes that life is uncertain, and that there is often some risk that a particular course of action will be attended by negative, unintended consequences. A cautious person has skill in accounting for uncertainty and risk, both the known and unknown unknowns, and evaluating options. She also prepares for the contingency that possible risks will materialize and makes provisions to avoid or mitigate them. Finally, at the bottom, I classify memory and docility as support virtues because they assist the operation of practical reasoning at multiple points. We adopt ends based on our understanding of our present situation, but the situation that confronts us is not simply a bare assemblage of facts. We construe situations as affording us opportunities for action based on their meaning or their significance for us. And the meanings we assign to a situation often depends on how we interpret it in relation to past events and activities. To respond well to our present situation, we therefore need an accurate memory of the past. Having good memory also supports deliberation, judgment, and command. Deliberation requires causal knowledge, which is gained through experience and instruction and must be retained in memory to be of any use. The situations that confront us in the present may never be precisely the same as those occurred in the past, but they are sometimes analogous in certain respects. And a person's capacity for judgment is improved if she is able to remember and learn from her own successes and failures, as well as those of others. Finally, we often deliberate and make choices about matters that will be implemented in the future, and so we must remember our decisions in order to command them at appropriate times. The eighth integral part of prudence is docility, which is the ability to seek out and listen to advice from others, especially those who have more experience or expertise about the subject matter than we do. The docile individual, quote, solicitously, frequently, and respectfully applies his mind to the teachings of the learned, not neglecting them out of laziness or despising them out of pride, end quote. The practically wise person is not a solitary sage. At the stage of construal, the opinions of others can enlarge a person's view of the situation, enabling him to perceive ethically relevant factors that he may not have previously noticed. Aquinas' Latin term for deliberation, concilium, which means to take counsel, also reminds us that practical reasoning is typically a communal activity. And besides helping us to deliberate about the possibilities, those with experience or expertise can help us arrive at good judgments about which option we should pursue. In summary, then, my guiding idea has been that before we can get in the business of cultivating practical wisdom in our cadets and midshipmen, And before we can assess whether our methods for doing so are successful, we first have to understand what practical wisdom is. I've suggested that Thomas Aquinas can provide us with some of the needed insight into the nature of prudence or practical wisdom. I don't know and I don't want to claim that Aquinas has given us a complete list of the integral parts of prudence. But I do believe the 8 parts he discusses form a plausible starting point, a place where we can at least begin the conversation. Thank you.
All right, Patrick.
So I realize that I think I'm the last talk that's standing between you and the booze upstairs. So I'll be quick. I realize that our virtues of temperance are limited. So, and also I say about Bruce Springsteen, I regret nothing. So, but all right. I want to talk to you today about challenging a bit of a premise that I think is common in these sort of discussions, which is that really virtue is inherent or intrinsic, or we can get people to be more virtuous through instruction, right? Through teaching them NE 203, teaching them the philosophers, or habituating them through training and practice. That these are the mechanisms, right? So these are the mechanisms. There's sort of your inherent virtue, and then there's habituation, training, education that raises your virtue or lowers your virtue depending upon it. And there's some complex intermingling between those things. And those are really the tools. Those are the levers we have. Is that we have something like an ethics class and something like training, right, where we just get people to habituate doing the right thing over and over again. Those are our options. And I kind of want to say, well, there is perhaps a third option. I actually think there are two other additional options. One is to change the environment or the context, right? So I think, for example, in the military context, doctrine and technology and weapons the rank structure and things like that also affect people's ability to be virtuous. Just do a kind of quick, this fourth element here is that, so for example, as my understanding is that Russian tactical doctrine is that they fix positions through movement and seek decisive fires. So they rely upon artillery to generate decisive breakthroughs, whereas U.S. Air-land doctrine is to suppress and fix enemy positions with fires and then seek decisive movements, envelopments. Now, if you think broadly speaking, these are the roughly two different sort of general doctrines of ground combat, you might think that some of those doctrines are going to be more conducive to being virtuous than others, right? And so one thing we could talk about doing is altering the weapons we use, altering the rank structure we use, altering our doctrine and our operational planning and things like that. Obviously, the Naval Academy is not in the position of doing that, at least not directly. So I'll set that aside. But the one I do want to talk about is what we'll call moral bioenhancement. All right, so moral bioenhancement is the idea that we can improve and enhance people's ability to act ethically through medical interventions. The medical interventions that are normally being considered here are often pharmaceutical. You take a drug, and this drug will affect your level of, say, racial resentment. Or it will affect the likelihood that you're going to feel hatred, or it might affect the extent to which you'll feel fear. There are drugs that seem to enhance people's sense of fair play, right? Now, I don't want so these are drugs that might enhance one's ability to deliberate on the ethical concerns because it might take away things that sort of cloud our moral judgment. But it also might provide us with additional motivation such that once we've decided that something is the right thing to do, we follow through on it. Now, I don't need to get into specific details. That's not really what I'm interested in. What I'm interested in is the idea of whether this is a strategy that's worth pursuing, especially on, say, maybe a voluntary basis within the general set of tools that we might use to make people more virtuous. So if we're thinking about how to make midshipmen more virtuous, maybe we should get them high, right? So that might be a way to do it. So I mean, again, some of the, so for example, microdosing lithium, microdosing acid, there are other sorts of things. These are things that seem to trace certain kinds of positive psychological dispositions. There's also deep brain manipulation, things like that. We don't need to get into all the details because the purpose of this paper, or the purpose of this paper, or this talk, is not to convince you to do it. What I want to do is I want to sort of adopt an anti position, which is that I want to look at the arguments that there's something intrinsically problematic about doing this and show that those arguments fail. It's an open question whether any of these interventions will in fact work in the field. It's an open question whether they're safe. It's an open question whether if there are any downstream problematic effects. I'm going to leave all of that to the side. I will say, though, it seems like some of these interventions can manipulate some of the pathways that James talked about in ways that make it more likely that people are going to do the right thing. There's some plausible science behind it. There's some promising investigations that indicate this. So the question is it worth pursuing this as a way of making warfighters more virtuous, right? So in order to answer that question, we have to say, well, what would be some reasons for thinking that we shouldn't do it, right? What are some reasons for thinking that this is intrinsically problematic? So in order to sort of get the argument off the ground, we might say, is there something wrong with pharmaceutical enhancement of any trait in general, right? So is enhancement itself intrinsically bad? That might be one question. So there are some people like Michael Sandel who have argued what's called the bioconservative position, which is essentially that technological and pharmaceutical enhancement of people's performance is generally bad. So this would be true if we were enhancing warfighter survivability or their ability, their ability to deliver precise fires, things like that. So exoskeletons and things like that would be potentially morally wrong. But also any kind of pharmaceutical, what's the drug that Air Force pilots use to stay awake?
Modafinil.
What?
Modafinil.
So that kind of thing would also be morally problematic on this view. Now, what is the reason behind this? Well, generally, they have to sort of show why modafinil or why other kinds of interventions are problematic, but training isn't problematic. Right? So we enhance people's capabilities all the time. In fact, that's what we're trying to do with moral education, is enhance people's decision-making capabilities when it comes to moral issues. Why is it okay to teach people and to train people, but it's not okay to do it through a pharmaceutical intervention or through a technological intervention? And generally, the bioconservatives will say, well, it's because one of these is not natural. Right? This is doesn't strike me as a particularly convincing argument because smallpox is natural, and we still do that. And of course we use, for example, although this used to be less controversial, we use vaccines to enhance people's immune system. And so again, it's not clear why we would care about naturalness. And then other things, and the other arguments they make, for example, are that, well, we don't have to work very hard. We get it for free, whereas training and education is through sweat and hard labor and things like that. And you're like, well, what if I'm just really good at moral reasoning, so I only need a little bit of training, so it's easy for me and it's hard for you? Does that mean that we should value your virtue over my virtue? That doesn't seem obviously very plausible. So generally, I think we want to say enhancements, if they are safe, if they are effective, right, and they improve performance on grounds that we have reason to care about, we have good reasons to pursue these kinds of pharmaceutical and technological enhancements in general. Well, what about moral enhancement? Maybe there's something especially bad about something problematic about moral enhancement, right? Because moral bioenhancement are these pharmaceutical and technological interventions to improve and enhance people's moral decision-making and their moral actions. Is there something wrong about that? Maybe it's okay to give a warfighter an exoskeleton so they can carry a heavier weapon and they can wear heavier armor, that kind of thing, right? Or maybe give them night vision goggles, for example. That's a perfectly fine technological enhancement, but it's not moral, because moral enhancement is intrinsically bad. So what would be the reason for thinking that it might be that moral enhancement might be intrinsically bad? Well, one reason, which I'm going to set aside for a second, is that there's just greater disagreement about morality, right? There's lots of disagreement about morality within our society. There's lots of disagreement about what we should be pursuing, and that's different from other kinds of values that we care, other kinds of values in the military space. So we need to set moral bioenhancement aside because there's just too much disagreement about what kind of virtues and what kind of moral decision making we want people to achieve. I'm going to set that aside, and we'll get back to that in 1 second. Another argument would be that this violates our autonomy. All right, so autonomy is, from auto and nomos, is the giving of a law to ourselves. We are, in some sense, supposed to be the authors of our own lives, and moral bioenhancement essentially forces us to be good by bypassing our judgment, bypassing our considerations, right? And so there's a sense in which if we were to adopt moral bioenhancement, it would be a particularly problematic undermining of our autonomy by essentially trading out our moral judgment for the moral judgment of the pill, right? That would be sort of an objection. And I think there is something to this. I think there are going to be certain kinds of moral about enhancements where essentially we are bypassing our own normative and moral judgments. And that is going to be problematic. I think if everyone's seen the movie the RoboCop, the really terrible new one, not the really great old one, but the really terrible new one has this sort of idea in which really the technological system is making the decision, and it just makes the person in the cybernetic suit think that they're making moral decisions, right? So it's a way, and so they basically take the human out of the loop, but kind of give them the pretense that they're making choices. That seems definitely like a violation of autonomy. That would be highly problematic, and I think this is something that we're going to have to deal. This kind of issue we're going to have to deal with at a much greater level when we start using autonomous systems as centaurs, where we work with AI-governed systems, and we have to kind of say who made the choice. Was it the AI or was it the person in a particular context? But I don't think that all interventions are like this. I think lots of interventions that we're talking about are more about enhancing our own judgments. So to give you an example, although I don't think this study is replicated, there was a paper that indicated that when judges have low blood sugar, they're more retributive in their sentences. So basically, you don't want to catch a judge when they're hungry, because if they're hungry, they're going to send you to jail for longer. All right? Turns out that there's actually there's an explanation that's innocent, which is that the harder cases are done later on. So anyway, so it doesn't matter. But the point is that, but again, imagine that I as a judge knew this about myself. I knew I was going to become more retributive over time. And so as I got hungry, so I kept Snickers bars at the bench so that I could make sure that I had enough blood sugar, and I would make decisions that fit my own judgments about what was right and wrong. Well, that's in some ways a pharmaceutical intervention, right? The pharmaceutical is sugar, right? But it is pharmaceutical intervention. No one thinks that would be problematic, right? And I think we want to think most of these interventions are along these lines. They do not violate free will. What they do is they serve as aids and guides, and they do in two basic ways. One way is they strip away the things that might cloud our judgment, things that we believe, that we endorse, and we say we don't want. So hatred, or biases of other kinds, anger, these sorts of things. Or two, they help us see a moral consideration that we were tending to ignore. So like by increasing my concern of fair play, or another big intervention would be to increase my level of empathy, I can see a moral consideration that was hidden to me before. Right? And so in many ways, so if we think of these interventions as more guides and as assisting our own judgment, as essentially giving us, strengthening our own ability to make our own judgments, then I don't think that this autonomy objection succeeds. However, I do think it's a real danger, and we need to think about it a little bit more robustly to make sure that any particular intervention is not undermining autonomy. So they can undermine autonomy, but it's not a necessary feature of moral bioenhancements that they undermine free will or autonomy. Sometimes they're just a helpful guide or an assist. If they're like that, then I don't see the intrinsic problem. Now let's talk about martial virtue in particular. Is there what's special about doing moral bioenhancement for warfighters? And I think there are a couple of things that need to be taken into account. That one that's in favor of moral bioenhancement of warfighters, and one that is a reason to be a little bit worried. So the reason to be in favor is that I think the moral disagreement problem is actually not as bad in the military context as it would be if we were just doing moral bioenhancement like for everybody, right? Because as we can see, right, we are already in the practice in the military context of picking out the relevant virtues that we need warfighters to have, in part because we have a relatively well-defined set of normative considerations based on just war theory and the law of armed conflict of how we want our warfighters to act. And so there is a consensus within our community about what are the kinds of virtues that we want soldiers to have, at least at certain basic levels, right? And because there are normative, moral, ethical aims, that is avoiding war crimes, right? Avoiding war crimes, following the law of armed conflict, being discriminate, being proportional. These are things that we all share. And so I think the moral disagreement problem is not as tough in the military context as it would be if we were just pursuing generalized moral bioenhancement. I'm going to end because I think I'm about 15 minutes.
You're good.
Okay. So the last thing that I would want to mention, though, is I do think issues around consent and experimentation are trickier in the military context because we sort of claim to have greater control over what midshipmen and sailors can do with their bodies, right? We can order them around, we can require them to get vaccinated, things like that are a little bit more problematic in civilian contexts. I do think that if we start treating warfighters as guinea pigs for these kinds of experimentations, that is a particular kind of really sort of problematic exploitation of their position. So a kind of concern about this would be, for example, pharmaceutical companies taking advantage of the very, very poor in South America and Africa to test dangerous drugs. And because they're in such a bad position monetarily and in terms of health, the pharmaceutical companies can now exploit that position to get people to agree to engage in these sorts of experiments and trials that would not fly in the United States or in Europe. And so I do worry that there'd be a similar kind of dynamic here where because warfighters are in a reduced position to be able to say no, we might try to exploit that position when it comes to experimenting in the context of moral bioenhancement. So I think it would have to be the case that we have to be very careful that these experiments are done in a way that's voluntary. And we're not just treating our warfighters as sort of guinea pigs for this sort of experimentation. On the other hand, right, but I would want to say that is not a decisive objection. It's a thing to be concerned about. It's a thing to be aware of when we're doing these sorts of interventions. But it isn't itself a decisive reason, because I don't think we'd want to say that, one, it's impossible to sort of make someone try to be more virtuous, because we're in the process of doing that already, right? That's what we're doing, right? That's what the whole conference is about. So it can't be intrinsically wrong to kind of put pressure on midshipmen to be better people. That can't be, because that's what we're doing, right? And two, it can't be. I don't think it's the case that any technological or pharmaceutical intervention on a midshipman on a warfighter is intrinsically wrong, because again, vaccines and also the kinds of enhancements that we're thinking about when it comes to
Exercise.
exercise that's an enhancement that again we make people do. So it can't be the case that it's intrinsically wrong. Yeah. So anyway, so this is so they can't be intrinsically wrong to make people do this, but it is a concern that we have to sort of weigh in the context of this sort of field, especially because the known side effects and kind of and effects of the interventions are still very much in the early stages. And so we have to be very careful that we're not, and also very careful we're not sort of putting them in a position where it'd be very difficult to psychologically demobilize from the military and things like that. So there are kinds of concerns that we would have to take into account, but I don't think that they are insurmountable. So this is not a full-throated, we must do this, but it is an argument that there's no reason for us not to think about it seriously and to pursue it and to see whether it can be done safely and effectively. That's all I got. Thank you.
Well, we have about 5 or 10 minutes for questions, and then we'll go outside to get our pictures taken, and then reception upstairs. So questions from anybody initially in the back. Yes, sir.
You said it's a spitball here, but there's some growing science that questions, neuroscience that questions free will, whether free will is really there. And we see this in the Marine Corps with TBI injuries and infected behaviors that come afterwards. If there is, and going to the last speaker, sorry for reading the old man, if that is true, does that help answer some of those restraints? If free will is not there, if it's a structure, it's a physical thing, and we can affect that, does that take away some of the inhibitions?
Yeah, I mean,
Parts of it. Hold on, he's got to answer first, and you get to answer second.
Or vice versa. So you're talking about TBI?
Traumatic
Brain injury, right? Okay. Yeah. So the problem with the TBI is that you lose the integrative network capacity of the brain working as a unit. So once that happens, I'm not going to say all bets are off, but many bets are off, because it depends on a whole host of things. The individual's prior health, their prior cognitive function, the extent of the TBI, their recuperative function, the type of TBI it is. So one of the big concerns that we looked at, and we did the TBI study for Navy and Marine Corps back in 2008 through 2012, was whether or not a traumatic brain injury across the board, and we view these things as spectra, are capable of affecting individuals' decisional processes in those ways that could impact what might be seen as virtuous activity in military and martial constructs, right? And the short answer to the question is yes, it can. But we have a saying in brain sciences, see one brain, see one brain. So when I alluded to the point of personalized and precision medicine, here that is paramount. But to do that effectively, you need three things. Number one, you need a working baseline for each individual. Number two, you need comprehensive ongoing research and clinical care to be able to support that individual through whatever that may be, and certainly assess those range of functions, not only structurally in terms of what happened in their head, but what are their manifestations. And third, you need to define specific parameters that are operationalizable by which this individual is capable of functioning or non-functioning and make that yay or nay decision based upon those. In other words, are they physically qualified or NPQ? And these are real criteria. So these actual criteria are referred to as Ellis criteria. And if you're interested in getting those criteria, I'd be happy to provide them with you after the talk.
Yeah, so I think it's possible that if we came to understand ourselves as not having free will, then autonomy-based concerns would be less significant, right? Or voluntariness concerns would be less significant because the concepts of voluntariness and autonomy wouldn't apply. I do think it's the case. We want to be careful, though, because we might say that you need medical consent, not because we're respecting people's metaphysical free will, but because it's good for it leads to better medicine and better outcomes if the patient kind of has uptake with the process or something like that. So there might be non-free will based reasons to care about autonomy and consent and voluntariness, but they might not be as strong. I will say one thing though, right, is that sort of traumatic brain injury and other kinds of ways in which people can lose certain capacities for decision making would only undermine certain understandings of free will. Namely, these are sort of libertarian accounts of free will, which involve sort of the metaphysical ability to act other than you did. But there are what are called compatibilist accounts of free will that are really more about the nature of the pathway in your mind or your brain that leads to the decision. And so those views would be consistent with the idea that sometimes traumatic brain injury could make you lose free will, but other people wouldn't have it. And so there are so whether we want to adopt compatibilist or libertarian accounts of free will, and which one best grounds autonomy and consent as a moral concern, these are philosophical questions that people have been debating for a while. So I think you're right that if we really thought that the lack of free will undermined the value of autonomy, then it would serve as a lesser constraint on our bioethics. Yeah.
Dr. Henrik Seiss.
Thank you for the papers. Wonderful with the Thomas Aquinas paper in there as well. But I have a philosophy of science question for Dr. Giordano. Thank you very much for your presentation. I'm reading my way through one of the arguably best books on human understanding. Bernard Lonergan's Insight, and about emergent probabilities, the non-systematic nature of the universe as we see it. And he warns against the dangers of reductionism. So with all due respect, and it is great for both neuroscience and your work, is there a danger that we are being reductionistic about human action?
Yes.
You reduce it to EVG is greater than EDL.
Yeah.
And therefore also come into danger of reducing the human mind, the human brain.
So it's a wonderful point, and if I didn't touch on it explicitly, it was my apology. It was certainly implicit to the entirety of the talk. I don't think that there's any neuroscientist who works at the interface between the cognitive neurosciences and the social neurosciences who for a moment would say that mind is brain. I mean, I can tell you from my own experience, we simply do not know how brain works in some way to be able to instantiate this thing, mind. Is it a box, a receptacle? Is it an antenna? Is it a generator? Is some combination of all of the above? If that's something you're interested in, that particular discussion is in a forthcoming paper in a journal called Mind and Matter. It's coming out in about 2 months. I'd be happy to give you a preprint. But I think one of the things that becomes very important is a contingent use of any neuroscience and technology. In other words, we want to ground it to a viable, quote, neuroethics, is what the neuro prefix means. The neuro prefix in no way presupposes and/or does it direct reductionism. In fact, just the opposite. The fact that our brain is embodied and the body is embedded instantiates a biopsychosocial reality because you simply cannot take one out of the other to be able to get that type of perspectival orientation to what a brain-mind does. So the contemporary view in neuroscience, and certainly our own research, is that you have to appreciate the nature of that wholeness in a way that is considered to be anti-Mariological. And there's an actual anti-Mariologic argument that's been well advocated by Michael Bennett and Peter Hacker in their book, Philosophical Basis of the Brain Sciences, that we adhere to and advocate very, very strongly. And the more we know about the way brains work, I don't care if that brain exists in a bat or that brain exists in a human, the more we recognize is that its situatedness and that the nervous system works as an organ of relationality and a system of relationality really takes on a very Heraclitean perspective of parts and wholes that are inseparable. So my hope is that the contemporary perspective of neuroscience as neurobiopsychosocial science captures that in a richer and more finely grained way. So the thesis that I advocate is, no, not at all. Or are we simply targeting the brain, and by targeting the brain, therefore saying that is the essence of the self, but recognizing that brain targeting, as my colleague referred to earlier, and Dr. Smith referred to, is, I think, an important aspect of being able to aspect and access certain aspects of the system within the systems in which those systems interface in what may be directionable ways. Over.
Thank you. Dr. Luban.
It seems to me that one problem with interventions, chemical interventions of this kind, is that they seem like they're very emotion specific at a time when you don't know whether the emotion is appropriate. So I'll just go back to my original question. Is the order take your compassion pill, or I'll court-martial you if you take your compassion pill?
I think, so the answer that I would probably say in this context is it depends. So one thing is that it's not all emotional, but so some of it's like, for example, fair play, but it's more complicated than that, right? Which is that, for example, increasing empathy through this intervention, it leads people to treat perceived in-group members better, but leads them to treat perceived out-group people worse. So we tend to think of empathy as like just intrinsic, just if we want people to be more moral, we make them more empathic. Turns out that it depends a lot on which interests of which populations you care about. So, but I would just say, like, I could imagine, for example, suppose we were doing a patrol where we were looking for weapons in some kind of counterinsurgency operation in which virtuous kind of restraint was really important to winning the hearts and minds. Then I might say, everyone take your de-hating pill. But if we're like seizing Hill 357, then we might give them a different pill. So I could imagine that we might give them pills, and it'd be an interesting question about like how on earth we could possibly figure all that out. I think that's a tricky question, but I do think it's pretty plausible that we would think that there are contexts in which we want this particular enhancement, and other contexts where we don't. But it would require a lot of careful sort of study about those cases. But yeah.
So if I could add to that, because in applause to add to that, the situation that you raise is not all that hypothetical. It represents an actual case within frame of something we're dealing with right now at the Defense Medical Ethics Center. And so this is a whole DOD, so we'll leave it very, very vague. The situation we have is that an individual may be engaged in a particular set of activities, and they're looking to take certain things that may make them a better combat warfighter in those activities. Right? The question is, if those things are not necessarily A, approved, or B, might even be illicit in the general population, could they actually then be warranted in these circumstances, number one? And number two, if the individual is doing those things and it's making them a better warfighter in those ways that are contextually appropriate with an approved set of justifiable boundaries by consensus, is that then allowable? It basically is the counter argument to what you're saying is, if you don't take this, I'll court-martial you, but since you are taking this, not, because it's making you better at what it is you're doing. It's a real case. It's a case they're currently dealing with. And interestingly, one of the things that it raises is the point that Dr. Smith raised earlier, the whole idea of consent within the military. And part of that also goes back to what is the context. Is this being provided within a medical setting? And the medical setting gets incredibly touchy when you think of medicine left or right of bang. So military preventive occupational medicine works primarily on healthy people to keep them essentially healthy, operationally protected, and enabled. Yes, that acronym spells HOPE. So if we're going to give them hope left of bang, the question is how much? And what do we do with that? And I'd love to be able to give you an answer, but it's just a hell of a question we're still working through. But it was a wonderful question on your part, because that wasn't storybook, that's real.
And we had a question up front, sir.
Dr. Smith, when you talk about consent, you made me think of my anthrax shot, but the question about
Yeah. There you go.
when you contrasted training or compared it to pharmaceutical enhancement, it made me think of Dave Grossman's book on killing and the use of training to overcome our natural aversion to killing. And then maybe a related question, kind of the one thing that you categorically kind of label as immoral was murder, but the military imperative to make the distinction between killing in a military context versus murder. So, to anybody on the panel, your thoughts on those?
I think that's right. It's interesting whether we describe that as an enhancement by overcoming your natural impulse not to kill. But certainly it's an enhancement when it comes to warfighting in the context. But I think what I would say is that what we'd want to think about is there are, I think that there are studies about like when do war crimes happen, and a lot of times, so one of the overwhelming things is that it's a relatively small number of toxic individuals. So one of the things that you can really do is just get rid of the bad apples. Is one of the things you can do. Is that makes everyone else more virtuous as well. But I do think that it's like people who are fatigued, people who are tired, but people who are angry or feeling hatred And so there are these there are momentary outbursts, and if you have something that controls those momentary outbursts, then people will often themselves think better of it in the context. So one thing is that can we have interventions that keep the aggression that we need in warfighting contexts, but put boundaries on it so that it doesn't, so that we are empathic towards the civilian in a way that leads us to restrain ourselves, even if we are in the middle of some kind of thing where like our buddy just died and we have bloodlust or something. That's the kind of scenario where I think enhancing empathy in a targeted fashion can be helpful. And of course, leadership, that's what leaders do, right? A good unit leader is going to recognize that the person's feeling this way and then pull them back while they recover. But you can't always do that, and so that's why we might think of other kinds of interventions.
Colin, if you want to see some real-world scenarios of that, take a look at Andy McKinley's work out of 711 Squadron out at Wright Pat. He's taking a look at various forms of transcranial magnetic and electrical stimulation to shift individuals' threshold to act or non-act in exactly those circumstances of what may be discriminable as murder or killing within military contexts. A paper came out in 2018.
Well, I get the last question, and it's for Josh. You were talking about the deliberative function of phronesis as evaluating the ethical content of means, okay? But what's the virtue associated with evaluating ends? And when I say that, I'm thinking about something that David Brooks said this morning about recognizing the worth of persons. So is that part of phronesis too, or is that a different virtue in itself, the virtue that recognizes the worth of persons, which I think has a lot to do with the ends that are selected as possibilities?
Yeah. Well, Aquinas at least follows Aristotle, who states that prudence is especially about the means to the end.
Yeah.
For both of those philosophers, there's an ultimate end that is just set by nature that all of us has, which is to flourish or to live well.
Yeah.
But that's extremely generic and open-ended, and there's lots of different conceptions of living well that have been put forward.
Right.
So I was grouping understanding as a virtue that's involved in truly understanding the order of different human goods, how those fit together into a well-lived life, and then specifying what in this context does living well here and now look like.
Yeah.
So that's not the ultimate end, but it sort of is the specified end of what virtuous living or living well looks like in these circumstances. When it comes to recognizing the dignity and the worth of the human person, I mean, I think that's it's a speculative view, right? I mean, it's something that the mind can know. That doesn't necessarily, but it can be translated into action. I think it's particularly important for the virtue of justice,
Right.
because our dignity as human persons is what ultimately grounds our rights.
Yeah, I was just trying to kind of tease out the cognitive aspect of the virtue of justice. It would be some aspect of prudence that would reinforce one's, I don't know, recognition of the nobility of giving others their due. But well, what exactly would you call that, I guess, is,
Yeah.
which we don't have to answer today, but just wanted to kind of mention it. Any other questions from the floor? Let's see. Cadet, and then we'll end. I'm sorry.
For actually the whole board, I have a question about the concept of like improving the environment of warfare and whether or not that improvement, like in the soldier, is actually a complication that may not be desirable in fact in all cases. So, like you were saying, take your combat bill or I'll court martial you. But like in the combat situation, you encounter some sufficiently complex situation that you
So let me jump in first, and then I'll hand it on over to Patrick. There's a big presumption there that there's the unknown aspect of the pill, right, or whatever that is. And when you actually look at how the research is put into translation, so that whether it's a device or whether it's a method, you're looking at its scientific and technological readiness level in terms of research, development, test evaluation, and then evaluation towards use. You're looking at 4 key elements. One is the actual mechanism of whatever the thing is. Number 2 is its biological activity in some confined system. Number 3 is its biological activity in humans in some confined system, basically a laboratory. And then there's the attempt to try to gain some what's called ecological validity. In other words, you field test it. Absent the continuity of those 4 variables, characteristically, much of things that would be translated into military aspects of operationalizability will never see fieldability, particularly with these forms of biological enablements. And again, the distinction of what represents an optimization, an enablement, or an enhancement are actual terms that have been codified that I think really help to clear up the discourse a little bit. But one of the points that you're leading to is one of the key points of contention. How well do we really know what the thing does, number 1, and are the acute effects different than the latent effects, and are those latent effects at all predictable? There is something called OnRamp, which is an operational neuroscience and technology risk assessment and mitigation paradigm. It was developed through DARPA. If that's something you're interested in, email me. I'll give you the actual the listing of that, which looks at 6 defined parameters in questions of responsibility, key questions of framing, and then also contextualizations that address exactly that issue. Because what we're trying to do is disambiguate the nature of what might be the mechanism of the thing biologically and its effect cognitively and behaviorally so that we can get relative continuity of the two. Did I answer your question, sir?
Absolutely, you did, sir.
Okay.
I think I was thinking like more of like a specific situation where, like, say that for some reason you judge taking alcohol to be like conducive to good performance in this tactical situation. So, but then like you reach a situation where you're like, maybe being drunk is not the best situation here. How do I think if I'm not drunk? And then you fail to. And is the complication actually useful, or is it in all cases not useful? Like,
So I think one thing would be like, is that if we were reaching the point at which you reasonably think that the pill is telling you to do something, then we're at the point where there are some pretty serious autonomy concerns, which also would be true if you were drunk, right? So this would be, in a sense, if you were taking a pill that would undermine your ability to sort of make the judgments yourself, as opposed to having something that served as an aid or a guide, then I think that we would have pretty serious objection to a pill that operated in the fashion that you describe, I think. For precisely the reason you're talking about, is that there is a point where you have to make a decision about it, and if it overrides. But again, it doesn't have to operate that way. Like I'm thinking about, in ancient military cultures, it was very common for people to go into combat, singing and chanting. So a nice example of this would be the New Zealand rugby team, right, that does this before every game. Well, that's to manage fear, right? It's an assist. So if we can think of, if we are looking at interventions that do that kind of thing, but no one would say that because I did the Maori chant, I no longer can think through what I should do myself. So we want interventions that behave more like that, but the concern you have is a very real one, and there are going to be some interventions that are going to be more like what you describe, and I think we'd have pretty serious objection to it.
Thank you. Well, with that, I think it's time to call it a day, and we're not going to offer any pills. It's going to be cocktails instead. But I hope the method to this madness is becoming somewhat apparent. Today was Concepts Day, so we're looking at these broad themes of what the virtues are and what they might be capable of doing, how to develop them, how to assess them, and which kinds of virtues the military might need in the future. And then tomorrow we're going to look at specific programs that are existing and see whether these concepts are informing those programs. And if they're not, maybe how they might be changed. So that's our task tomorrow. And with that, let's go outside and take a right and go right outside the door, and we'll take a group picture very quickly, and then everyone is welcome to go upstairs for a reception. It's going to be a little bit chilly, but not too bad. So thanks for your attention, and we'll see you outside.
Thank you, sir.
Good job.